Good morning, Jim. My name is Promise. I was just wondering if we could sit down and chat about your liver functions test. Okay, is there anything to tell me about the liver before we start? Alright, so the liver helps function out or filter out toxins. It also helps with digestion using those proteins and fats and everything to make energy for your body. We have 7 different labs here. I'm going to go over them, explain them as best as I can. Let me know if you have any questions, okay? So the first one is aspartate aminotransferase. This is the AST. We use it to detect tissue damage in your organs, so not just your liver. The normal range for this is 10 to 40 units per liter. We'll come back and report anything if we find something abnormal. We'll talk about solutions, your treatment plans, diagnosis, all that. Some drugs that are known to affect the liver can cause an increase in those levels, like opioids, large doses of Tylenol, or large doses of vitamin A. If you have increased levels, you may experience feeling weak and tired, the upper right stomach pains, and yellowing of the skin and eyes or jaundice. If you have decreased levels, you may experience some muscle weakness. We usually don't see this, but just in case. Low energy and difficulty breaking down some proteins. We're talking about this test now, just letting you know what it does, and we'll perform that blood draw, apply pressure, come back to you, and let you know what we find there. Our next one is ALTs, alanine aminotransferase. This one's more specific to the liver, still detecting liver damage. The normal range for this is 10 to 40 units per liter. We'll talk about diagnosis, treatment plans. If we find anything abnormal, we might have to run some more tests. So lead ingestion and some drugs like Thorazine, Aldermat, morphine, and Dilantin might cause an increase in the R levels. Liver inflammation or pain in that area, loss of appetite, and dark urine. You may have symptoms if you have increased levels, and a decrease in those levels. We usually don't see anything, but if you experience tiredness, overall weakness, just let us know. We're talking about this now before you take our test. It may be a little bit uncomfortable. Just letting you know what this test does before we do it on you. Just let us know if you have any discomfort after, and we'll monitor that for bleeding. Our next test is the alkaline phosphatase. This is the ALP. We use this one to check the condition of your liver and your bone. The range is usually 40 to 130 units per liter. If we report anything abnormal, we'll talk to you about that, and we might prepare you for some more tests, and we'll talk about solutions, everything after that's done. So some things that may affect your results are ingestion of vitamin D, which increases the bone activity, and then eating fatty foods increases the liver's activity. If you have higher levels, you may experience some bone pain, itchy skin, or jaundice, yellow the skin and eyes, and then a decrease in those levels may experience some tingly or numb feeling, and that might be a sign of a zinc deficiency or magnesium deficiency. We'll make sure that you don't eat or drink 8 hours before this. We'll collect that sample, and then we'll let you know when you can eat again normally. Our next test is direct bilirubin. This one's for checking for backed up bile, so the liquid that breaks down those foods, we don't want any blockages in there. The normal range for this is less than 0.5 milligrams per deciliter. We're preparing for more testing, let you know what's going on if we find anything abnormal. Some antibiotics, depressants, and medicines that lower blood pressure could affect these, so like barbiturates, sulfonamides, all that. If you have lower levels, you might experience some yellow skin, so jaundice, yellow eyes, dark urine, or light stool. We usually don't see any symptoms if you have lower levels. We're talking about this test now. We will perform that and come back to you, apply pressure, let us know if you experience any pain. Our next one is total bilirubin. This one shows the liver function and any blood cell destruction. This is the range from 0.1 to 1 milligrams per deciliter. We'll prepare you for more testing if you need, and we'll talk about our results and everything afterwards. This does have the same factors affecting our levels, like the antibiotics, the depressants, and medicines lowering blood pressure. You might experience itchy skin, tiredness, yellowing of the eyes and the skin if your levels are high, and we usually don't see anything for the decreased levels. Our next test is albumin. This is to determine if you have kidney or liver disease, or if enough nutrients is being absorbed in your body. The normal range for this is usually 3.5 to 5 grams per deciliter. We'll come back to you, report anything, maybe restore some of your electrolytes in an IV just in case it's high. Overhydration will dilute those levels, leaving the levels low, as well as penicillin. Some signs that your levels are high would be dehydration, even though we usually don't see that. So thirst and a dry mouth, as well as severe vomiting and diarrhea. The symptoms for low levels would be poor wound healing, fatigue, and malnourishment. We'll talk about this now. We'll perform that on you, and we'll let you know if we see anything. Our next one is total protein. We do this to find any constant illnesses or chronic illnesses and to know the amount of nutrients being absorbed into your body. The normal range for this one is 6 to 8.3 grams per deciliter. We'll come back and report anything to you as well as your doctor and prepare you for more testing if needed. If you're pregnant, which you are not, you might experience a decrease in these levels, as well as some drugs that will work against the test, but we will not be giving those to you beforehand. You might experience dehydration, tiredness, and a hard time moving the joints, so knees and elbows if it is high, and some fragile hair and nails, muscles becoming weaker if your levels are low. We're going to talk about this now, let you know when it's safe to take those medications after, and make sure that we come back to you and let you know about that if we see anything abnormal. All right, and that's all of the tests. Did you have any questions for me? Okay, all right, have a good day.